We now focus on the vital role of medical oncologists in the fight against cancer. These specialized doctors are at the forefront of patient care, using cutting-edge treatments like chemotherapy, immunotherapy, and targeted therapies to battle cancer from within. They don't just treat the disease, they guide patients through every step of their journey, coordinating with a team of experts to create personalized care plans. From diagnosing to managing side effects, medical oncologists are dedicated to offering hope and healing in some of the most challenging moments of life. Their expertise is changing the landscape of cancer care, one treatment at a time. To tell us more, we have oncologist Dr. Denky Dela Rosa via Zoom. It's a beautiful day, Doc Denky. Good morning.
Good morning and beautiful day to everybody.
You know what, Doc? I missed you so much. I haven't seen you in a long time.
Yes, it's been a while.
I know. It's great to have you on the show. Doc, we're talking about a serious topic today. Can you walk us through the steps involved in diagnosing cancer and how you determine the most appropriate treatment plan for a patient?
Okay, so in cancer, we have this dictum wherein no meet, no treat. So it means that for almost all cancer patients, except liver cancer, a biopsy is always very essential. That's the explanation with what I said, that no meet, no treat, because almost all kinds of cancer we need to have a biopsy. And a biopsy means we take a sample of the tumor, send it to the laboratory. It's going to be evaluated under the microscope, and then the pathologist will tell us what type of cancer the patient is. And once we have already confirmed the diagnosis of cancer, the next stage is to identify the extent of the cancer, and that is what we do with staging. That is when we find out whether the patient has stage 1 to 4 cancer. And after we have diagnosed the cancer, determine the stage, and also, of course, we need to identify what are the status of the patient's liver, kidneys, and all the different organs, because those are all very important. Age alone is not a determining factor of whether or not a patient can undergo treatment, but more of the functional status, meaning how strong the patient is, how strong the other organs are before we institute the treatment. And it's good that in the introduction you mentioned about immunotherapy and also targeted therapy, because there is this misconception among patients that chemotherapy is all there is for cancer management. Maybe that was true about 10, 20 years ago, but nowadays we have all other new medicines, and a lot more medicines are going to come into the picture in the management of cancer.
Doc, you mentioned biopsy, getting a biopsy to determine what kind of cancer you have, and then to determine also what stage the patient is already in. But sometimes we go to the doctor and we find out that it's already too late. We've jumped stages already from 1 to minsan stage 3 na. Is there a way for us to, is there a test that's available to check if you do have cancer? Kasi minsan, di ba, when we don't feel anything, we don't feel pain, we don't go to the doctor. Or if we don't feel mass somewhere in our body, we don't go to the doctor. Meron bang test that we can take beforehand to check, especially if there are cancer patients in the family?
Yes, that's right. Unfortunately, because the Philippines healthcare system is mostly out of pocket, a lot of patients tend to postpone even if they already have some symptoms. They tend to postpone going to the doctor, hoping that what they're going through is something that will go away. And it's actually very common practice among Filipinos to go to the drugstore and just tell the pharmacist, like, inuubo ako, anong pwede mong ibigay? So here is where cancer screening comes in. But not all cancers are actually amenable for screening. When we talk about screening, it means that we do the test even if there are no symptoms, there are no palpable mass or nodules. But the only cancers that are amenable to screening are breast cancer, cervical, lung cancer, colorectal cancer, prostate cancer. So these are the 5 different types of cancer wherein screening has already been proven to have a significant benefit in patient survival.
We also talk about genetic testing from time to time kasi minsan talaga we say it runs in the family, the cancer. How is that integrated into the approach that you have when we are diagnosing cancer and of course looking at treatment as well?
Yes. Before we don't have geneticists in the Philippines, but nowadays there are already doctors who have been trained in cancer genetics. However, we don't just do genetic screening on everybody. Even cancer screening, not everybody is going to be a candidate for that. We have certain parameters that we follow in applying who to test for, who to screen for cancer. And similarly, cancer genetic testing, there are also a lot of parameters that have to be followed. For example, the most important here will be the patient's family history. So we look at who among the relatives and what will be the degree of association with the patient at hand the cancer patient has been. So if, for example, who are the very good candidates for cancer screening? Those patients who have been diagnosed at a very early age. Because a lot of times cancer is related to lifestyle. And patients who are diagnosed very, very young, these are not necessarily, or probably, I'm sure that lifestyle has a role, but for patients who are very young, this is where genetics plays a bigger role than lifestyle.
Now, Doc, you mentioned that cancer is mostly a lifestyle thing. So both of my grandparents, both my granddads, they actually passed away from pancreatic cancer. Both super healthy, they don't smoke. So when that occurs, would you say that's genetics or is that, I don't think that's lifestyle because like I said, they were both super healthy. So what would you say would the cost be for that?
Yes, cancer is always a multifactorial disease. It is not only caused by lifestyle per se, but it's actually a combination of genetics, environment. Because you have people who have been smoking almost all their lives, but they don't develop cancer. Or maybe they die earlier than developing cancer. So, well, of course, we advocate for healthy lifestyle, but what I have seen in the clinics is that some patients can really be affected by cancer, even if they've been living, a very healthy life. So it's a mix of genetics, lifestyle, and I would say a lot of luck.
Oh my gosh.
Luck obviously is it's hard to really rely on as if you ask anyone, especially with a diagnosis. But just out of curiosity, because there are cases wherein, for example, treatment doesn't work, but are we seeing a higher rate of success with regard to the increased types of treatment that we now have available to us? As you mentioned, in the past it was just chemotherapy, but of course right now we're seeing targeted versions of it and even some different types of medicine and care. Is the success rate rising? And at the same time, how do you deal when a certain treatment is not working, when a cancer is involved, and of course when it recurs?
Yes. The chance of being cured from cancer increases the lower the stage is. Meaning the smaller the volume of cancer, the smaller the size of the cancer, and the less extensive the cancer is in the body, increases the chances of being cured. Even if I have mentioned that we have these newer medicines available, not only chemotherapy, a lot of the patients who are stage 4 still remain uncurable.
Doc, what role does palliative care play in your treatment plans, especially for patients with advanced cancer?
Yes, firstly, before I answer that, I would like to say that you really did very good research on the questions that you are asking. For example, before introducing me, you were telling the audience that the medical oncologist looks at the patient in a more holistic way. That's actually So thank you very much for your research team for coming up with all these very nice questions. So going back to the question about palliative care, palliative care is actually a specialty in medicine. But of course, an oncologist, being doctors who care for cancer patients, palliative care is part of our curriculum. So palliative care is actually one of the areas that I, as an oncologist, also focus. And an example of palliative care would be addressing the patient's pain. Because sadly, about 70% or more of cancer patients throughout their journey can experience some sort of pain, especially in the advanced stages of the disease. Palliative care does not only belong for patients who have very, very advanced cancer. Palliative care can actually be implemented even the very early stages of cancer. I would also like to state that because since we're discussing cancer and palliative care, people might think that palliative care is only for cancer patients, but palliative care is a specialty of medicine that relieves discomfort. So even patients who have heart disease, kidney disease, any type of medical condition that needs the care of relieving discomfort and taking care of the psycho-spiritual aspect of the patient can be referred to palliative care. Here in our country, again, sadly, most of the palliative care specialists are in the urban areas. So I really have difficulty for my patients who come from far away provinces looking for palliative care doctors. So, well, at least after the pandemic, people have somehow gotten used to using Zoom, Messenger, or Viber for consultation. So at least we are able to somehow reach them. But the problem is when the patient would need morphine for pain control. During pandemic, we were allowed to provide the prescriptions because morphine is a regulated drug. It is under the Philippine Drug Enforcement Agency. So not all doctors can actually prescribe this medicine. So during the pandemic, it was relatively easy because we can just send the prescription through Viber or Messenger. But now that the pandemic has already, it's no longer pandemic period, we are now again required to give the special
Yeah.
prescription, and the drugstore will not dispense the medicine unless the patient has that special prescription. So it becomes very difficult for patients who are very, very far away.
Doc Denky, we hate to cut you off there, but then we're running out of time. Of course, a lot of people, I'm sure, would want to know more about this. We could actually go on a long podcast about this topic. But Doc Denky, where can patients or prospective patients reach you and, of course, learn more about this?
I have clinics in St. Luke's Medical Center in Global City and UERM Hospital. You can actually just easily search my name. I have TikTok, I have Facebook. You can just write the name that you see on the screen, and I'm sure I'm going to come up in Google.
Thank you so much, Doc Denky. It was such
Thank you,
an
Anne.
interesting conversation with you. Thank you so much. I'll see you soon.
Thank you. Bye-bye.
Thank you, Doc. You know, content creator yung si Doc, and I love her content. She actually teaches a lot about cancer prevention, the right food to eat.
Yeah, so that's why you can check her out on social medias
Yes.
that she mentioned a while ago.